Hi, my name is Zamora, and the social problem I chose for this presentation is homelessness. So, homelessness is basically a combination of many factors that make up the social problem, and these include like poverty, low wages, unaffordable housing, mental health issues, and substance abuse, which also includes like drug abuse too. Sociologists say about this topic. So, in the article review or literature review, the sociologist said that the root of the social problem was the structural factors like economic inequality, the lack of affordable housing, systematic issues like gentrification. And then in the review, it specifically mentioned that a lot of the loss of affordable housing is due to gentrification and the decrease in funding for housing projects. Uh, the health and well-being sociologist examined the impact of homelessness on individuals' health and well-being. The review mentioned that the outbreak of diseases like hepatitis A among homeless people due to the lack of sanitary facilities and marginalization. Sociologists studied how homeless people were marginalized by society, which led to like further exclusion and discrimination. The review discussed the frustration that the public had with the behavior of homelessness, like drug abuse, substance abuse, panhandling, that showed like the perceptions that people had towards the homeless population beforehand. And for the empirical results, the table showed the decade and population prediction. And for 1980s, it showed that there was an emergence of more research due to the increasing homelessness rates, focusing on structural factors and economic changes. For 1990s, there was a continued rise in the homelessness, focusing on mental illness and substance abuse. In the 2000s, there was an increased focus on the intervention effectiveness and demographics shift in the homeless populations. In the 2010s, there was a greater emphasis on prevention strategies, social factors, and long-term outcomes. And so for the populations, it showed that individuals, the reviews, or I mean, the results on individuals focused on chronic homelessness, mental health issues, substance abuse, and other socioeconomic factors. For the youth, it studied on runaway children, family dynamics, abuse, neglect, and educational disruptions. For family, it showed the family instability, economic hardships, domestic violence, and housing policies. So for the potential solutions, I chose conflict theory, and those three solutions or potential solutions were economic redistribution, affordable housing initiatives, and the expansion of social safety nets. So the strengths of the first potential solution was that it promoted higher income equality, it addresses the causes of homelessness, and it supports welfare programs. The second potential solution, the strengths of it were increasing like housing affordability, provided stable housing for like more of the population, and it addressed the failures of housing. And for the third potential solution, it increase the strengths where that increases the access to essential services like mental health services and even like mental health services. It addresses the issues of homelessness, and it decreases the number of the homeless population. Oh yeah, and then for the increased access to essential services, that also included healthcare. For limitations of the potential solutions, there was a for the first one is there would be like an opposite result if it didn't go well. There would be an insufficient funding for like housing projects, and then for the second one, there would be like a limited availability of housing because it would be like first come first serve, and it would like run away or run out quickly. And there would be unintended consequences like side effects that we wouldn't like predict. For the third potential solution, I said the limitations were like limited access to the services and insufficient funds to provide the services. And these are the references I use for the slides. And that's it.